Uganda's Health Ministry spokesperson Emmanuel Ainebyoona is on the line with us to talk about this outbreak. A very good evening to you. Thank you so much for speaking to us, and please forgive me if I have pronounced your surname incorrectly, and welcome for correction, please. What can you tell us about for the very latest in terms of fatalities there?
Thank you very much, and good evening to you and all the viewers. Currently, our cumulative deaths stand at 21, 4 confirmed and 17 probable. But Uganda has a lot of experience in handling viral hemorrhagic fevers, and we hope that this outbreak will be handled in the shortest possible time.
As I mentioned earlier on, in terms of the figures, there were 7 suspicious deaths. And at this point, given the outbreak, what would make them suspicious? And is it just in one district? Because we believe Mabenda district was where these cases came from.
Yes, the epicenter of this Ebola outbreak remains Mabenda district in the central part of the country. And we had a number of community deaths. The 17 that remained suspicious are those that have not been confirmed or have not happened in the health facility, but people died with a known illness, and that links them to Ebola virus disease. That's why we have them as probable.
And just to confirm, according to the WHO report, so initially 43 contacts had been identified and 10 believed to have caught the virus and are receiving treatment at a regional hospital. What are the total number of cases now, and is it the first time that Uganda has detected the Sudan Ebola virus strain since 2012 particularly?
Yes, Uganda has had the outbreak of Ebola 5 times now, and there has been reported this specific Sudan strain in previous outbreaks, and it was contained, and we expect the same to happen. We have been following up a number of contacts, and some, for example, we have had some cases outside Mabenda in another neighboring district called Chegegwa, and another one in Kasanda, and all are linked to the index case. So the contact tracing is ongoing, and our experts are following up these contacts, and the testing is ongoing. Those ones who are found negative, they are dropped out of the contact list. But the situation remains dynamic, so I cannot state now the exact number, because they might have taken in a number of new suspected cases. So we wait for the other situation report, I think, tomorrow. That one would now give us a clearer picture of the situation. But cumulatively, we've had 34 confirmed, 34 cases, of which 16 are confirmed and 18 are probable.
Okay, let's look at the area of Mabenda. I believe it's located in the central region of Uganda. It's around 2 hours by car from Kampala, but it's along a busy road leading to the Democratic Republic of Congo. How difficult does that make contact tracing, but also more importantly, making sure that you at least localize the outbreak?
Yes, indeed, there are some measures that have been in place. On Saturday, the Minister of Health, Dr. Jane Ruth Acheng, visited Mabenda district and had the National Task Force meeting in Mabenda as a way of morale boosting the health workers and also best understanding the extent of the outbreak. So far, there are local measures that have been put in place by Mabenda, for instance, putting a halt on nightclubs, social events, Those are some of the measures to limit the spreading. We will be having a Zoom meeting tomorrow with all the health workers to ensure that we orient them about the case management, also about the high levels of suspicion when the patients present, and also on infection prevention and control. So there are several measures, and we have also listed other districts that neighbor Mabenda, about 13 of them, including Kampala, to ensure that the teams are on high alert and all health workers are able to screen any suspected persons who present with symptoms and signs of Ebola.
And Mabenda, I believe that it's a mining area, so it does make, just in terms of the virus spreading further, more likely because of the increased risk of traveling. So the WHO having sent a technical team there to the district to support surveillance, infection prevention, control. Can you tell us a little bit more about how this will help you in the management of cases?
Yes, from the word go, from day one, we've been working jointly with the World Health Organization through their country office. We've had joint teams on our rapid response teams, and this will boost up the health workers on the ground to combat contact tracing and also ensure that all the contacts are followed up. So that technical support is highly welcome.
All right. Thank you so much for speaking to us there. That is Uganda's Health Ministry spokesperson speaking to us about the latest there.